Stacy Erholtz has been cancer-free for more than a year. She has a doctor armed with an experimental virus to thank for it.
I just have not felt this good for so long. I don't remember feeling this well.
In 2004, Stacy was diagnosed with multiple myeloma, a blood cancer that forms in plasma cells. Despite multiple treatments like chemotherapy and stem cell transplants, her cancer always returned. But Stacy's failure to respond to conventional treatments made her the perfect candidate for an experimental one. Oncolytic viral therapy, a treatment that uses a virus to hunt down and kill cancer in the body. In myeloma patients, Dr. Stephen Russell of the Mayo Clinic saw a window of opportunity.
This particular form of cancer, multiple myeloma, is associated with loss of the antibodies against viral infections that you've previously had. So many of the patients who have myeloma, who've had a great deal of previous therapy, who've run out of options, they have no detectable measles antibody in their blood.
And with no antibodies, Russell's weaponized virus can target and kill cancer cells in the body, a process which in turn kickstarts the immune system to also attack the cancer. In initial trials, the virus proved ineffective, and that's when doctors upped the dose significantly.
They didn't put it in relatable terms, which was beautiful for me. I said, don't do that. People don't need to know they're getting enough measles to vaccinate 10 million people.
Stacy's initial response to the dose was a dangerously high fever and extreme vomiting. But by the next morning, a golf ball-sized tumor that had protruded from her forehead started shrinking. Within 36 hours, it was gone.
Over the next few weeks, everything disappeared. We couldn't find any myeloma in her bone marrow. The repeat PET-CT scans over the next few months gradually became fainter and fainter until we couldn't see anything.
I was lit up like a Christmas tree, and then the colors just started to fade to black. And next thing, 6 months later, I am clean and clear. No sign of cancer.
A second phase human clinical trial is now underway at the Mayo Clinic. Dr. Russell says engineered viruses will eventually change the way all types of cancers are treated. The job now is to find the most efficient path to allow killer bugs to tackle a killer disease.